How to talk about cervical cancer without shame. Talking about cervical cancer openly is important for health and awareness, but many people feel embarrassed or ashamed to discuss it. To change that, we need to understand the real facts and challenge common myths. First, recognize that stigma often comes from misconceptions, especially linking cervical cancer to sexual behavior. Many believe that if someone has cervical cancer, it's because of promiscuity, but that's simply not true. Cervical cancer is caused mainly by persistent infection with human papillomavirus, which is very common and can affect anyone who is sexually active. Most people clear the virus naturally without any health problems. It's important to remember that having HPV or cervical cancer does not reflect a person's character or morals. Using accurate and compassionate language helps break down shame. When talking about HPV, emphasize that it's a widespread virus, and most sexually active people will get it at some point. It's not a sign of moral failure. Instead, focus on the fact that cervical cancer develops in some cases when HPV persists over time, but it's preventable and treatable. Education plays a key role. Let people know about the importance of HPV vaccination, which protects against the most common high-risk types of the virus, and routine screening tests like pap smears and HPV tests. These screenings are safe, effective, and recommended for all eligible women regardless of their sexual history. When people understand that prevention is accessible and normal, it reduces fear and shame. Creating a culture where conversations about reproductive health are normal and supported is essential. Healthcare providers trained to deliver respectful, culturally sensitive care can help patients feel safe and supported rather than judged. Sharing stories of those who have experienced cervical cancer can humanize the disease and show that it can happen to anyone. Support groups and social media campaigns can foster community and reduce feelings of isolation. Framing screening and vaccination as routine health practices, like going to the dentist or getting a flu shot, helps normalize these actions and removes the idea of shame. It's also helpful to involve men and the wider community, since HPV is transmitted sexually. Educating everyone about shared responsibility can reduce gendered blame and promote healthier attitudes. By focusing on facts, compassion, and education, we can make talking about cervical cancer easier and stigma-free. This approach encourages early detection, increases vaccination rates, and supports those affected. Remember, if you have concerns or questions, always consult healthcare professionals who can provide personalized advice. Open conversations, free of shame, are vital for improving health outcomes and creating a more understanding world.